Rabies is an communicable disease, viral disease. Look at this picture, rabies virus and disease mechanism and disease transmission. Look at this. Detail going on. Introduction. Rabies is a viral zoonotic disease that causes fatal encephalitis in humans and other mammals. It is a public health concern worldwide, especially in Asia and Africa. Rabies is preventable but almost always fatal. Once clinical symptoms appear, early recognition and timely intervention are crucial. Definition. Rabies is a acute, progressive viral infection of the central nervous system caused by the rabies virus, typically transmitted through the saliva of an infected animal via bites or scratches. Etymology. Rabies comes from the Latin word rabere, which means to rag or be made, reflecting the aggressive behavior seen in infected animals. It is also linked to the Sanskrit word rebus, meaning violence. Epidemiology. Rabies causes an estimated 59,000 human deaths annually, with over 95% of cases occurring in Asia and Africa, particularly due to dog bites. Children under 15 years old are most commonly affected. And lack of timely access to post exposure prophylaxis contribute significantly to mortality rates. Types. Rabies manifests in two main clinical forms. One, furious rabies, characterized by hyperactivity, hydrophobia, aerophobia, agitation, and hallucinations. Two, paralytic rabies, marked by muscle weakness and paralysis, often misdiagnosed as Guillain-Barré syndrome. Causes. Rabies caused by rabies virus transmitted through 1. Animal bites, especially dog, bats, etc. 2. Scratches from infected animals. 3. Saliva contacting broken skin or mucous membranes. 4. Rarely through organ transplantation from an infected donor. Risk factors. 1. Living in areas with high prevalence of rabies. 2. Working in veterinary or animal control professions. 3. Outdoor activities like camping or hiking. 4. Lack of vaccination pre or post exposure. 5. Delayed or improper wound care after exposure. Complications. 1. Coma and death. 2. Paralysis. 3. Seizures. 4. Respiratory failure. 5. Cardiac arrest. 6. Permanent neurological damage. Pathophysiology. Here is the step-by-step pathophysiology of rabies. 1. Viral entry. The rabies virus enters the body through the bites or scratch of an infected animal, introducing the virus laden saliva into the wound. 2. Local replication. The virus replicates locally in the muscle cells and connective tissue near the sites of entry for a few days. Incubation base. 3. Neuromuscular junction invasion. The virus binds to nicotinic acetylcholine receptors at neuromuscular junctions and enters the peripheral nervous system (PNS). 4. Retrograde axonal transport. The virus travel retrogradely backward via motor neurons through axons towards the spinal cord and the central nervous system (CNS), bypassing the bloodstream and immune detection. 5. Central nervous system infection. Once in the spinal cord and brain, the virus replicates rapidly, leading to diffuse encephalitis, especially affecting the brainstem, hippocampus, and hypothalamus. 6. Symptom manifestation. Neurological symptoms such as agitation, Hydrophobia or paralysis develops due to inflammation and neurological dysfunction. 7. Centrifugal spread. The virus spreads outward via peripheral nose to other tissues, including the salivary glands, skin, eyes, and respiratory tract, facilitating further transmission through saliva. 8. Fatal outcome without intervention before symptom onset. Rabies leads to coma, respiratory failure, and death typically within days of symptom onset. Signs and symptoms. Initial prodromal phase. 1. Fever. 2. Headache. 3. Malaise. 4. Itching at the bite site. Progressive phase. 1. Furious rabies. Agitation, hallucinations, hydrophobia, hypersalivation, anxiety. 2. Paralytic rabies, muscle weakness, and flaccid paralysis, coma. Diagnosis. 1. Clinical history, animal exposure. 2. Saliva testing, RT-PCR for viral RNA. 3. Serum and CSF testing for antibodies. 4. Skin biopsy to detect viral antigens. 5. Negri bodies in brain tissue. Nursing diagnosis. 1. Risk for infection related to virus exposure. 2. Acute pain related to inflammation or neurological involvement. 3. Impaired physical mobility related to muscle weakness or paralysis. 4. Anxiety related to threat of fatal illness. 5. Risk for ineffective airway clearance related to progressive neurological decline. Medical management. A. Post exposure prophylaxis PEP. 1. Immediate wound washing with soap and water. 2. Rabies immunoglobulin RIG infiltration at the bite site. 3. Rabies vaccine series days 0, 3, 7 and 14. No effective treatment after symptom onset. Supportive care only. Nursing management. 1. Monitor neurological status. 2. Provide psychological support. 3. Ensure airway patency and manage respiratory function. 4. Administer medications and vaccines as prescribed. 5. Educate patient and families on wound care and vaccination. Treatment options: 1. Pre-exposure prophylaxis for high-risk individuals, example veterinarians, travelers. 2. Post-exposure prophylaxis, vaccine plus rabies, immunoglobulin. 3. Supportive care, mechanical ventilation, sedation, anti-epileptic drugs. 4. Milwaukee protocol experimental, including coma and antiviral treatment, very limited success. Psychosocial medicine: 1. Counseling and emotional support to addresses fear and anxiety post exposure. 2. Education about rabies, transmission, prevention, and treatment. 3. Family involvement for emotional backing and care coordination. 4. Grief support in case where rabies progresses to fatal outcome. 5. Community awareness programs to reduce stigma and encourage early reporting of animal bites. Prevention: 1. Animal vaccination, especially dogs. 2. Avoid contact with stray or wild animals. 3. Public education on bite prevention and first aid. 4. Pre-exposure prophylaxis for at-risk groups. 5. Control of stray animal population. 6. Promote wound care and PEP administration after exposure. In conclusion, rabies is a deadly but preventable viral disease. Public awareness, timely wound care, and prompt post exposure prophylaxis are critical in preventing the progression of the disease. Although there is no cure once symptoms appear, global initiatives aimed at controlling rabies through animal vaccination and education campaigns have the potential to eradicate human rabies deaths entirely. Thank you. Have a nice day.